good day to you. My name is Dr. Simon Wade, the Webinar GP, just bringing you news of the next live and interactive quality CME and CPD webinar for GPs. And the next one is all about bipolar disorder in primary care, diagnosis and management. And it takes place on Thursday, the 19th of February, 2015, 8 p.m. GMT with Dr. Daniel Dietch. Now, Daniel will be presenting on bipolar disorder in primary care. Dr. Dietch advises that the bipolar disorder is complex, but GPs can play a key role. And this presentation will help clarify some of the diagnostic and management issues relating to managing and looking after bipolar disorder in primary care. So the learning outcomes, why is there some controversy about bipolar disorder? Secondly, what is the difference between bipolar 1 and bipolar 2, and why does it matter? Thirdly, admission avoidance, how to stop an episode escalating. So we're often under pressure to try and avoid admissions, whether it's a physical problem or mental health issue. And with bipolar, there's some key learnings about admission avoidance and how to stop an episode from escalating. Fourthly, fourth learning outcome expected from this presentation, some useful non-pharmacological strategies that you may not have heard about, orange tinted glasses, omega-3, and some nutritional aspects of managing patients with bipolar disorder. And fifthly, there's so much to pack in on this webinar. Fifthly, fifth learning outcome expected, what to do with that lithium result. So talking about lithium results. So the webinar is equivalent to 1 CPD credit, and obviously you can double that if you can show impact later on. Now, a little bit about Dr. Daniel Dietch. Daniel's an FRCP, DCH, and MRC GP. Daniel graduated from Manchester University in 1992, and he gained experience in general and acute medicine before moving to general practice in 2000. He's been a partner at Lonsdale Medical Centre, a large teaching practice in northwest London, since 2001, and has a diverse range of interests, including mental health, nutrition, rheumatology, and internal medicine. And within primary care, he provides an innovative service for patients with bipolar disorder. And working closely with GP and psychiatry colleagues, Daniel has presented at academic meetings, including at the International Society for Bipolar Disorders, the Royal College of GPs, Royal College of Psychiatrists, and the Institute of Psychiatry in London. So remember, when you register for the webinar, you'll be emailed a unique set of login details. And if you can't make the live webinar, as long as you've registered, you'll receive an email within 24 to 48 hours of the live session. That email will contain a link to access the recording so you can watch it at your leisure. Now, it might be the first time you've come across webinars for GP. So who am I? What's it all about? Well, I'm an experienced GP with over 20 years experience as a GP in the UK. I've been running live and interactive weekly web-based seminars or webinars for CPD and CME for GPs and nurses. And I've been doing that every week since January 2013, apart from obviously Christmas and New Year. So we've done over 50 hours of CPD every year and really enjoying the feedback and the fact that the audience is growing steadily month in, month out. More and more GP colleagues are discovering this modern way to access continuing medical education and continuing professional development. You know, we're time stretched, we're pressured, pulled with increasing work demands. We've got a home life, and we have to integrate our work life situation, and we've got to do our CPD. And certainly lots of studies have shown that if you keep up to date with the medical advances and best practice as a GP, if you're able to try and keep on top of the changing knowledge base, then you can manage the stress of the job better. So a sense that one is falling behind is often a factor that adds to the stresses of GPs. And I'm all about helping colleagues to manage their stress, reduce the stress. So I'm passionate about helping colleagues get their CPD in a very efficient way, a cost efficient and time efficient way. You save on travel time, you save on travel costs, you do the CPD from the comfort of your own home. It really is CPD made easy for GPs in this modern 21st century. So I hope you'll join us on Thursday, the 19th of February, 8 p.m. for Daniel Dietch for Bipolar Disorder in Primary Care. Have a look on this page. If you're watching this on YouTube, there's a link in the description to go to the registration page where you can find out more about this webinar, and there are links to the website generally. And if you're on the page, have a look at the yellow button, the yellow add to cart button to pay for this webinar so you can sign up. You'll be taken to a World Pay page. And if you want to get the webinar for a real deal for £2.50, have a look further down on the page. There's an orange button. You can get a whole month of webinars for £10. So you can do a £10 trial and get a whole month worth of webinars for a tenner, £2.50 each, less than a cup of coffee in Starbucks, I think. Look forward to seeing you hopefully on the webinar. My name is Dr. Simon Wade, the Webinar GP. Enjoy the rest of your day. Thanks for your time.